Hello, my name is Stephanie Chung, and this is my final presentation on the importance of preventing sexually transmitted diseases. A little disclosure, all the images in this presentation are for mature audiences only and for educational purposes. What are sexually transmitted diseases? They are passed from one person to another through sexual contact such as vaginal, anal, or oral sex. Causes of STDs are mainly due to yeast, bacteria, parasites, and viruses. Sexually transmitted diseases affect both men and women, and there are over 20 different types of sexually transmitted diseases. There are some risk factors when it comes to having a sexually transmitted disease, such as unprotected sex. Having unprotected sex with someone who has an STD and isn't wearing proper protection, such as a latex condom, can increase your risk of getting an STD. Also, not using condoms regularly and improper use. Also, multiple partners, drugs, alcohol, and erectile dysfunction are also factors that can get an increase of having an STD. There are different types of STDs such as chlamydia, syphilis, gonorrhea, hepatitis B, and HIV and AIDS. Chlamydia is a very common sexually transmitted disease. Chlamydia causes damage to the woman's reproduction system, which may make it difficult or impossible to become pregnant. It may also cause a fatal ectopic pregnancy, which is a pregnancy that occurs outside of the womb. And for both men and women, symptoms include discharge, burning sensation when urinating, and rectal pain. The image on the right displays an ectopic pregnancy and the symptoms of chlamydia. Chlamydia is very common. Almost 3 million Americans get chlamydia every year. It's very common among the ages of 14 to 24. Syphilis. Syphilis may cause serious health problems if left untreated. There are 4 stages of syphilis: primary, secondary, latent, and tertiary. Each stage has different signs and symptoms associated with each stage. Primary starts off as a single sore, secondary, skin rashes, latent, no visible signs or symptoms, and tertiary happens 10 to 30 years without treatment, affects the brain, heart, and blood vessels. These images are displaying the symptoms of syphilis, the sores, and rashes. This image shown here displays that the African region has a higher prevalence of syphilis. Gonorrhea may cause infections in genitals, rectum, and throat. Symptoms for both men and women include discharge, soreness, anal itching, bleeding, and painful bowel movements. Gonorrhea is curable, but can be cured with the right medication. The images displayed here are showing the symptoms of gonorrhea. This image shows that both men and women in the ages 20 to 24 are more common to have gonorrhea. Hepatitis B. Hepatitis B is a liver infection caused by the hepatitis B virus, also known as HPV. Symptoms include fever, loss of appetite, nausea, jaundice, and vomiting. Hepatitis B is transmitted when blood, semen, or another body fluid from someone who is infected enters the body of someone who is not infected. Images shown below show a liver with hepatitis B and jaundice, which are symptoms of hepatitis B. Hepatitis B is very common. It's 257 million people global. Also, 2 billion people have been affected, which is 1 in every 3 people on our planet. HIV and AIDS. HIV stands for human immunodeficiency virus, and AIDS stands for acquired immunodeficiency syndrome. AIDS is more of an intense and harsh form of HIV. It causes harm to the immune system. Right now, there is no cure for HIV, but there are ways to decrease the risk of being exposed to HIV. Symptoms include mouth ulcers, rash, fatigue, fever. The images shown below show the mouth ulcers and the rash developed from HIV and AIDS. The image shown below shows that 36.9 million people are living with HIV. What are the first signs of an STD? Common symptoms for both men and women are painful urination, discharge, itching in the genitals, pain during sexual intercourse, and bleeding in the genitals. How does getting tested work? Getting tested could be from a urine test or a blood test. A urine test is more common for common sexually transmitted diseases, and blood tests are used for HIV and herpes. Where can you get tested? You can get tested at your local Planned Parenthood, clinics, physician's office, or any urgent care. Why is this a public health problem? This is a public health problem because there are an increase of sexually transmitted cases and there is a high mortality rate that is increasing due to sexually transmitted diseases. In this graph shown here, it shows that Native Hawaiian/Pacific Islanders and African Americans are more common to have sexually transmitted diseases in both men and women. There are various health disparities when it comes to sexually transmitted diseases, such as gender, race or ethnicity, socioeconomic status, geographic location, and so forth. A health prevention plan would include practicing safer sex and education. Safer sex practices include using latex condoms, limiting partners, and abstinence. Educating the public about sexually transmitted diseases are important because most people are not aware of the dangers of unprotected sex. In conclusion, it is important to practice safe sex, to educate the public about sexually transmitted disease, and to be aware of the different types of STDs out there. Thank you for listening to my final presentation.